Hey guys, Dr. St. Jean here. Thanks for tuning in at thechicagochiropractor.com. Today we're going to talk about some of the most common types of low back pain, things like disc herniation, spinal stenosis, and lumbar sprain strains. Stay tuned. When it comes to low back pain, there's a variety of symptoms that can be plaguing you. You can have localized, dull, achy tightness. You can have radiating, sharp, burning, electrical-like pain. Sometimes there's numbness and tingling, and even in rare cases, there's muscular weakness. The combination of those signs and symptoms helps us determine which type of low back pain you have. Probably the most common type of low back pain that we see in this clinic every single day is a lumbar strain sprain. What I mean by that is strain is injury to the muscle, sprain, SP is injury to the ligament. There's a ton of different muscles and soft tissues that make up your low back. Some are more prime movers, others are more stabilizers. The point is, when you're undergoing movements or trying to stabilize your body in certain ways, you can undergo some injury to the tissues. And that's when we get lumbar sprain strains. Typically, someone that's coming in with a lumbar sprain strain is going to present with pain that's localized to one side of the lower back. Usually they describe the pain as dull, achy, and a little bit tight. Sometimes they'll report a sharp twinge with certain movements, and usually the pain occurs with a bunch of different movements. It's not just one specific movement of the low back that triggers it. Also, we often don't see radiation of pain as well. Okay, we just learned about lumbar strain sprains. Another really common type of low back pain that might just be plaguing you is disc herniations. A great way to wrap your head around what a disc herniation is to think of a jelly donut. You can picture a jelly donut, right? It has that tougher, doughy exterior with the jelly, the more liquid base in the middle of it. The same thing is happening with the disc, anatomically speaking. We have this outer exterior that we refer to as the annular fibers, and then we have this inner portion that's more jelly-like. That's called the nucleus pulposus. So if you squish a jelly donut on one side, what's going to happen? Most likely the jelly is going to squirt out the other side. The same thing can happen with discs in your actual spine. And the degree to which damage is done, whether it's a tear in the annular fibers or actually nucleus pulposus is slipping out and spreading into the space and irritating nerves and so on and so forth, that determines how we refer to this. Because is it a disc herniation, is it a disc bulge, etc. The point is, the degree of injury determines the types of symptoms you as the patient will experience. So understanding the degree of injury is really important. Again, the degree of injury is going to largely determine the types of symptoms you're experiencing when it comes to disc herniation. So when it's a small injury, you might experience more sharp stabbing pain that's a little bit more localized, or if it's radiating, it might just be radiating a little bit down into the buttock or the lower back region. If it's a larger injury, you're probably going to see radiating or shooting pain shooting down that leg, sometimes even to the calf or even in the foot. Usually it's accompanied with some numbness and tingling, and even in severe cases, you might see some muscle weakness. Now here's the thing, guys. This doesn't always present in such a cookie cutter way. Sometimes there's a mixture of all these things and it's a small injury, or sometimes a mixture of all these things and it's a large injury. Oftentimes too, specific movements will aggravate someone with a disc herniation. Usually forward bending or leaning forward aggravates the pain. Now that you know the different severities and different types of symptoms surrounding disc herniations, another really common type of low back pain is spinal stenosis. And spinal stenosis, generally speaking, hits the older population. I'd say about 50 years and up. Of course, there's exceptions to that. Spinal stenosis is nothing more than narrowing of body cavities. So if you think about your spine, you have this big spinal canal where the spinal cord goes through. Any part of the canal that starts to narrow, that would be considered spinal stenosis. You also have these little holes of foramen on the side of your spine called your IVFs or intervertebral foramens, and when those become narrow, that's also considered spinal stenosis. Now the symptoms of spinal stenosis, again, kind of depend on the amount and where the narrowing is occurring. So you could have localized low back pain, or you could have radiating low back pain, again, depending on where the narrowing is and the extent of it. You also might experience numbness and tingling in and around the lower back, into the buttock, into the legs. Oftentimes patients will report getting fatigued in their legs and their low back when walking long distances. And what's interesting about spinal stenosis in terms of symptoms, and this is a great way to differentiate it from disc patients, is that leaning forward tends to relieve stenotic pain. That's why we often call it shopping cart syndrome, where we see the elderly leaning on their shopping carts while they're getting their groceries, and that's sometimes one of the places that they actually experience relief from this. Okay guys, there you have it. 3 really common types of lower back pain: disc herniation, spinal stenosis, and lumbar sprain strains. We see these all the time in our office. Stay tuned for some other videos that show you some exercises to relieve these different types of conditions. If you want more information on low back pain, scroll down and click our video blog link. We have a ton of articles and videos that you can read through and watch. And if you want to work with myself and get to the root cause of your low back pain and eliminate it once and for all, click the Schedule a Consult button right below. This is Dr. St. Jean from thechicagochiropractor.com. I'll see you next time. Bye-bye.